So why don't we transition and talk a little bit about Medicare and Medicaid reform? I think what we've seen in the past couple years and continue to see is really unprecedented reform through CMS and through CMMI in terms of setting up different programs. The ACO program, for example, received a lot of attention. We've got the Pioneer program, the Shared Savings Model program, and I think it's the Next Generation program that was recently starts the Star Trek program. Why don't we start there and maybe thoughts on sort of what that has or has not accomplished. Thinking about accountable care organizations. Segueing from our previous discussion, it sounds good, but what have been the results so far from each of your perspectives?
Want me to start with that one?
Sure.
Okay. First of all, Medicaid is such an important and such a necessary program. The poorest of the poor need a way to have their health care paid for, and they don't have the resources. Much of the expansion of the ACA, many of those people who were previously uninsured, the 11 million who are now covered, many of those, it's really people who were already, they were already candidates for Medicaid, but just never got signed up. And so to a degree, the ACA is an expansion of the Medicaid program. I think it's incredibly important. It's very, very expensive. And I believe that the government is looking to get some of that managed, and a lot of that is being pushed over to the private sector to see if there's managed Medicaid to help hold down costs, get these patients into a system of physicians and hospitals who previously didn't really want to take care of Medicaid patients, but as part of a system like this, they will. And I think there's some of that with the coordination of care with management of some Medicare patients also. But they're both, Medicare and Medicaid, incredibly important, but both of them are very expensive. Medicare could run out of money over the coming years. And there's cost shifting that goes on to the private health insured patient to subsidize those programs because they don't stand alone right now.
Right. So the acronyms, the ACA and the ACO are very confusing to kind of probably to the layperson to distinguish between them. But while we're on Medicaid, we'll come back to the ACOs in a moment. Francois, I think you have some opinions on sort of state decisions about whether to expand or not expand. And of course, we have a Supreme Court decision we're awaiting. That's going to have big implications, I think, for lots of people, but also for healthcare more generally in our country.
Yeah, well, as Art said, it's Medicaid was there for a reason. It is there for a reason. The expansion of Medicaid in many states has been able to capture the layer above the poorest of the poor who just were priced out of the commercial insurance market, and as a result of which had no access to insurance whatsoever, and at a very significant cost to both their health care and their life, generally speaking, because of the financial burden. So it is distressing at some level, at many levels, that certain states decided to opt out of Medicaid expansion. From a policy perspective, I don't know how you can justify leaving people completely out of the health insurance system. I don't understand it from an economic standpoint because it actually, I think, shows, and there are studies that show that the level of disparity in care that layer is subject to impacts their ability to contribute to society as taxpayers, et cetera, and so on. It has sequelae on their families and on generations. So it just doesn't make a whole heck of a lot of sense from a pure economic standpoint, and certainly not from a social standpoint. So many of us are obviously concerned by the King versus Burwell ruling, and we have to wait and see what happens with that. But irrespective of what happens with it, states that have and continue to make that decision to ignore the Medicaid expansion, to not provide a solution to the people who cannot afford commercial health insurance, need to wake up to the realization that it doesn't make sense. And I don't know anyone, I don't know whether you can explain it from an economic standpoint or not, but I've run out of any ability to explain it.
Francois, I completely agree with you, but I don't think it's an economic, I think it's a political thing. And I think that's the politics in this case in some states is trumping what is good patient care.
Well, and it's my understanding that there are some agreements to pay for uninsured between CMS and states that didn't expand Medicaid, and those are about to expire. So not only do we have this impending Supreme Court decision, which will wreak havoc depending on which way it goes, but also states like Florida and others are sort of subject to.
Well, it was part of the whole deal, right? So the ACA was a deal, and like any deal, you make compromises along the way. Some people get a little bit more in the beginning, a little less on the back end, but the fundamental premise of the deal was we're going to try to correct something that doesn't exist in any other industrial country in the world, which is the fact that a not insignificant proportion of the population simply does not have access to health insurance, and for the most part doesn't really have access to health care because they can't pay for the care out of pocket, and they certainly can't afford insurance. And so you make progress towards that goal, and then you see it in potentially the next 6 months being significantly ratcheted back, and it just seems like both a lost opportunity and a tragic mistake.
So let's go back to